about health equity. There are other health equity accreditations that are out there. Some of them started a year and a half ago. There's some other areas, some organizations that are emphasizing this in other programs. But I want to tell you about our journey. When it came to health equity, we feel that health equity is a very broad term, and we did not want to just repackage some old stale program and slap a new label on it and say, Lou, look, health equity. So we actually partnered with a broad committee. One of our key partners was the National Minority Quality Forum right there in the center of the screen. But if you take a look across all of these organizations who participated in our advisory committee, who helped shape this, I mean, this is a fantastic group of organizations. You've got organizations from all over healthcare, because health equity is all parts of healthcare. It's not just payers, it's not just providers, it's not just hospital systems. The corner pharmacy in Dubuque, Iowa could be working on health equity. The FQHC in Arkansas could be working on health equity. The multinational global pharmacy chain could be working on health equity. And we wanted to build a program that was actually reflective of whatever approach that you're using. Now, I'll also tell you, in some areas, health equity has a little bit of baggage associated with it, where people are like, oh, that's all just being used for such and such, and those sort of things. Our health equity accreditation was built from scratch with expert communities contributing to put together what I believe is the best program out there for health equity for anyone involved in healthcare. And these are the people, these are the organizations who sat around the table and helped us do a good job with this. Because I believe that if you don't have the right people around the table, what comes off of the table is not going to be good. So this is who we had, and we're proud of that group that's participated with us and continues to work with us on this. Next slide, please. So with this, I got to turn it back over to Jen, because she knows all the good details. So Jen, I'll turn this back over to you and I will disappear. But please take a look at our health equity accreditation. We would love to have more of you guys come on board and look at this and get on board, as we really think this is a fantastic program. So back to you, Jen.
Awesome. Thanks, Sean. So on our health equity accreditation, we wanted to go over some highlights to start. Some of this Sean did kind of mention already. But there's a few things that are a little different about this as well. So while we're still within the healthcare space, this program is more high level and not talking about specific healthcare practices, but really any healthcare practice where health equity may be considered. So this does not require an accreditation by URAC or any other accreditation by any other organization. It is a 6-month application process, similar to a lot of our other programs. It does have the 3-year accreditation cycle as well. We did work to align the standards with our standards with national standards for the culturally and linguistically appropriate services. And really integrate health equity principles across the continuum of healthcare, really looking to our council to help guide us in areas of healthcare that health equity principles should be applied to or could be applied to, which allowed us to broaden this accreditation considerably outside of either hospital or health plan. And then we really worked to create initiatives that would eliminate disparities among patients. Next slide. So there are 3 focus areas in this in this program. The organizational commitment, program plan, and equitable services and support all lead into the health equity accreditation. One key factor here is this program does not have traditional foundational focus areas, but there are many of our foundational focus areas integrated into the other focus areas that you see here. That's because we recognize health equity as an organizational initiative from the top down, and we want to make sure that the standards that we are using and any organizational foundational focus area type standards apply health equity throughout the organization, working to integrate it not just on a low level patient level, but all the way through the organization. So again, anybody can apply that is working to integrate health equity principles into patient care. This could be health plans, case management, pharmacy, PBMs, really anybody who's providing health services that allow for health equity principles to be integrated. The organization must have established self-monitoring practices that emphasize quality assurance and improvement. Again, we did align with our foundational focus areas in that aspect, making sure that health equity became a quality initiative throughout the organization. Next slide. The other thing that we looked at was the CMS framework for health equity. They have 5 priorities, all the way from data and assessment and reducing disparities to really access and accessibility, talking about language and minimizing risk. We worked within that framework to ensure that our standards also aligned with their standards or their framework priorities. Just really to make sure that as CMS continues to grow in health equity, we were remaining consistent with them as well.